Welcome to Voices of Care, real stories to inspire, uplift, and unite caregivers with hosts Maggie Linton and Carl Powell. Enjoy the conversation. We are so pleased that you all joined us today because we have two very special people. One you're kind of familiar with, Carl Powell, but the
Mm.
second one you do not know, and her name is Tani Salazar, and she's with the Hawaii Dementia Initiatives. Thank you both so much for joining us today.
Thank you for
Thank you for
having us both.
having us.
Mm.
Tani, I'm going to start with you because you have covered so many bases. Carl's been telling me a lot about the initiative, but let's talk about its inclusivity and how it all got started.
Thanks, Maggie. Hawaii Dementia Initiative, it's a coalition, of community stakeholders all around Hawaii who are passionate about brain health and dementia and caregiving, and we're all working together to collaboratively implement our state strategic plan on Alzheimer's disease and related dementias. And we started convening, I think, well, this work has been going on in Hawaii for decades, but specifically this group has been getting together since 2023, and we meet in action teams to brainstorm, okay, what does our people need and how can we make that happen?
And Carl was telling me you go to many different languages so that everyone will feel a part of this initiative.
Yes, we do our best, to ensure that people from every background, every culture, every island, can be a part of this. Because if we create programs or if we promote, brain health, we want to make sure that it speaks to people and meets people where they're at. So whether we're in urban communities or rural communities, whether we grew up in Hawaii or didn't, or, all these different cultures coming together in this melting pot. We want to make sure everyone feels seen and represented in the work that we do.
How did you first?
Donnie, what I was telling Maggie about was the menus that we were creating for the Polynesian diet, for the Hawaiian diet, for the Filipino diet, that is definitely specific to Hawaii because in other states we don't have so many diverse, what's the word I'm looking for? People.
Populations, yeah,
Yeah.
population
And
people.
so we really have to consider how everybody eats here and how what we eat is different, especially because we're on an island and our food is different.
So true. No, thank you for bringing that up. That's such an exciting project, trying to translate, the science about what is brain healthy foods. A lot of times we talk about the Mediterranean diet or the mind diet and how these things are showing, like research is showing that this is really good for our brains. But oftentimes in Hawaii, we found that the sort of foods that are in those diets aren't real common, to the palate here in Hawaii. And so our team has been working bring to translate that. So whether it's, looking at different parts of the mind diet and saying, what does that look like in an Asian diet or in a Polynesian diet or Filipino food, people from every background, we want to make sure that they are able to take these steps, in a way that's relevant to their culture. So thanks for bringing that up, Carl. And we're looking for more recipes if you all have delicious recipes you'd like to share, because we want to eat Ono food, but also prioritize our brain health.
The other thing you have to do is you're not just talking about the people you're caring for, but also the people who are doing the caring for. And supporting them is what's so very important with the Voices of Care and with also your dementia initiative.
Agreed. Our caregivers carry so much. And I think that's a big priority for the initiative and for the caregivers who are involved, who want to create resources and supports that would help them, on the journey to not only survive, but to thrive, and so that they feel supported to increase their own well-being, but also strengthen that, their themselves as they're caring for their person. So that is a huge priority, and we're trying to work to create more caregiver education and supports and training to help meet people where they're at.
What have been some of the bigger issues that you've come across in order to help create and expand the program? What are people missing that they think they're out there all by themselves?
That's a really great question. And, we were just finishing up a public awareness campaign, and it was focused on early detection of dementia and really educating the public about, those early signs and symptoms to recognize and encouraging people to talk to their doctor. And got all around, it reached people all around the state. But what we found in the surveys after that was that a lot of people were sharing that some of the biggest concerns, that families have are the emotional and psychological strains, that people are experiencing on the dementia journey and the impact, on the family and needing access to care because there may be some supports available. Of course, we need more. There's still a gap there, but the gap between people being able to access those supports, knowing where they are, but also feeling comfortable, to reach out and to ask. We're finding that dementia is such a personalized journey, and especially with the cultures, I think here in Hawaii, people really turn inwards. We're going to take care of this within the family, which is a strength, I think, that Ohana lifestyle. But at the same time, we want to empower people that your family doesn't have to do this alone. We want to come alongside you with support and education so that you can do it well together.
Just briefly talk about a couple of the programs that are out there that are needed.
Some programs that are needed.
Yeah, well, that are already in place. I'll put it that way. That's saying, okay, come on, be part of this. That's kind of like the invitation out to come in to help and seek help.
Thanks, Maggie. Yeah, from what I'm aware, there are caregiver support groups in each county. My office is at the state unit on aging, and we work with the area agencies on aging in each county, and they have caregiver supports and services. They could contact, to get some guidance on resources. They could join a support group. There's also some caregiver educational programs where people can come and learn more about dementia, learn more about what to expect on the caregiving journey and learn some caregiving strategies.
You mentioned some of the early signs, and they're always there, but the families try and act like, oh, the old saying, they're just getting old. But what are some of those signs that are over and over again in families that they wait maybe not too long, but are ignored and say, okay, they're just getting old before they realize there really is something wrong?
You're right. I think in my own family too, we noticed signs, but we thought it was just normal aging. But as those signs kind of compounded, our family started to notice, oh, this is not normal. I think we need to reach out for more help. And that is exactly what we're trying to get out, to the public, knowing that when these changes are different from the person's baseline, when memory loss, is disrupting daily life, changes in mood or behavior, forgetfulness, or difficulty with real familiar things, like things that, that they would normally really be able to do this, but we're noticing that they're having some challenges with that. And that's new. It's not what they had before. I think so when we notice those changes, it's really good to talk to a healthcare provider because those changes could be related to dementia, or they might not be. They might be related to a medical condition that maybe the healthcare provider can kind of treat and diagnose it, and it could resolve. So we're looking for any changes in their memory or thinking. Again, we can visit our website, hawaiidementia.org, for more information on those different signs and symptoms and, what's typical aging or what's not so typical, something to talk to a doctor about. But I wanted to ask Carl, what are some things some symptoms that you initially noticed on your caregiving journey?
It started off with just simple confusion. Why are you confused about that? Didn't we just talk about that? Didn't you ask me that question already? And in the beginning, just because we are who we are, I was a little short about, didn't you just ask me what time it was 15 minutes ago? And then after it happened, after a few months, then I started thinking, And so what I did was I got one of those calendars that was blocks. And every day you had to change the block for the month, the day, and I gave that to her. And then when I saw her really having difficulty with it, I thought, okay, there's something really wrong here. The hard part for me was then trying to convince the rest of my family that there was something wrong because Black people are very much like Hawaiian people, that everything stays in the home. Also, in Black and Hawaiian families, we have multi-generational households. And that's why it's so important because we have so many different generations living in one household. So we have to figure out how to teach the kids what dementia is and how to treat grandma when grandma doesn't know your name. And that's very,
Mm-hmm.
very important. We also have to then go into the people who, Tani, are your age, who are out there working and working hard and trying to make a living and don't have, more than 2 hours a day, maybe to dedicate to someone who is in need of care. And so then we also have to look at those things. How do we divide that out, those responsibilities amongst our family and still get along? And so because we live so closely together and because we have to be on the same train when it comes to what is the protocol for care. And so this is why in Hawaii I find it so much more important than other places where I've lived because we have a lot of kupuna. Hawaiian people, they revere their kupuna, which I love because a lot of places don't have that same view of kupuna. And that's I always tell people Hawaii is the only place I ever moved back to. And it's because I was getting old and I knew I was going to have respect when I got here.
And you knew there were going to be people who were going to care for you.
Absolutely.
Exactly.
That's true,
So what?
that cultural. Oh, sorry, go for it,
Now go
Maggie.
ahead. Go ahead. What you were going to say, please.
No, I just really appreciate what you shared, Carl. That's true. I think there's such a deep, respect for kupuna or for elders, and I think that's shared by many cultures, but both in the host culture in Hawaii and also different Asian cultures or like Samoan or different groups from Polynesia, this real collectivistic, oh, excuse me, this collectivistic culture that really brings together the family and cares for both the older generations and then the younger generations. And then I appreciate what you shared about the symptoms, like the frequent questioning, or the confusion or these different symptoms that I think we might not initially think to look for, but it's good
Mm.
to think about.
And it was simple, even as her following me around everywhere I went. And I didn't understand. She didn't know where she was sometimes. And so I was her comfort. And so as long as she was next to me, she felt okay. But as when I left or I left the room, sometimes she got a little confused. So sometimes I'd come home from work and she just would hold on to me, literally hold my hand through the house. And I would think, okay, this is kind of weird, but every single time it happens, you tell yourself, that's nothing because you don't want it to be that. You really don't want it to be that.
Yeah.
And so, as much as I tried to tell myself, oh, this is nothing, just let that go, just let that go, there comes a point when I looked at her and I just said, it's not good for her or for me. And that's when those caregiving pangs start because we don't understand at first. At first, you just think you're just doing what you normally do. And then all of a sudden your mother calls you mommy or something like that and you think whoa 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 and then you realize permanently the roles have changed. From now on I am mommy and that's the way it's going to have to be, and if I'm not prepared for that, that sends me into a tailspin. So I think a lot of people come in a tailspin because I wasn't prepared for this.
Yeah, and what a heavy kuleana or like responsibility that you carry, but also such an honor that
Right.
you were that person of comfort, the person that she knew I'm safe with him, I'm gonna follow
Mm.
him around, which may have been really difficult, that shadowing, right? But it shows what an
Mm.
amazing son you are to
Yeah.
her.
Yeah.
Yeah, that's so important. To not shy away, but to embrace the new
Mm.
role that you may have in your
Yeah.
family's life. And sometimes, because we've talked to a few people, who come from larger families, and there's still just usually one or two that are there that understand their responsibilities, and the rest act like everybody's already dead and they're a single child. They just go off into the sunset and act like they don't know what's going on. You
Ooh,
know,
those family
Mm.
dynamics can be some of the
oh,
hardest part, right?
and I bet
Yeah.
you have your job to do with some of those family dynamics too, helping families get through them, don't you?
Yes, yes. As a social worker, we're working with families. There might
Mhm.
be that one primary person who's there visiting and is really involved, but then they also have the dynamics to work with their siblings, or maybe there's a family member who lives on the continent or far away, but has a really strong opinion on how things should be done, and kind
Mm.
of navigating that. So we would try our best, to include the family when we can. Like, okay, let's have a family meeting. Like who do you need to have in this meeting? Let's do a conference call or get everybody on the phone, to make sure we're all on the same page, and making sure that the person we're caring for, that loved one, that kupuna, stays our focus. They're the center of this. Like, what's best for them? We may have different opinions on care and next steps, but let's come together and unify, in the spirit of
Yeah.
aloha. Let's really
Yeah.
focus on our kupuna. Yeah.
And what's so difficult in Alzheimer's and dementia is people, I don't want to say that they lie, but they tell stories. So
I like
my mother
that.
would my mother would tell different stories to different people. And so I would think, okay, this, and then she would say that, and then I think, okay, why did you tell Maria that I didn't give you lunch when you know that I gave you lunch? And then Maria had an opinion. Well, you're not feeding your mother the right way, but I want to tell Maria, you're not here every day. But you don't want to get angry with people when they're trying to explain it. My sister thought my mother was getting too much medication. So she thought that the better way would be to wait until she was at the point that she really needed the medication to give it to her. Where I was really on the tip that keep her ahead of any kind of pain or suffering that she had to do, because that's the way that I talked to the doctor about giving the medication. But my sister didn't have that conversation with the doctor. She had that conversation in her own head and decided that she knew a better way. And there's always going to be another person in the family who's going to come and think they know a better way because they're not there every day and they don't have to go through the everyday pains. They don't know what you've been through. They don't know what you've seen. And they just see what they see that day when they get there. And sometimes my mother, she was a good imposter. People would come and she'd be so good, like, oh, everything was fine, great, wonderful. And then people would leave and she'd go berserk. I mean, I'd be like, you were, you were fine 15 minutes ago.
What's wrong with you?
We present well when we know there's company there, right?
Right.
I think we still
Always.
have that with dementia. Like, oh, we have company here,
Right.
Or the doctor's there and everything seems fine.
Yeah.
Every time. Well, listen, once again, give us the website where we can go find out information, and really people encourage them to become a part of the Dementia Initiative.
Thanks, Maggie. Yes, so our website is hawaiidementia.org. And you can feel free to contact us, or you can email us at doh.dementia@doh.hawaii.gov, or our email. It's on the website too. And we encourage you to reach out to get involved. You can join one of our action teams and meet like-minded individuals, who are passionate about dementia and caring for caregivers, as well as promoting brain health. We also have social media. We have a Facebook or an Instagram, and you can feel free to connect with us there. And we really want to let people know, that you're not alone, that there are caregivers all around the state, who are working together, and all around the country and the world, really.
Mm.
They're saying 1 in 4, 1 in 5 people are caregiving for someone. And it's such a universal part of our human experience. I think the more that we talk about it, the less there's stigma, and the more we can support each other to promote our brain health, our well-being, and to support each other on our caregiving journey.
There's nothing more to say except come join us. Thank you very much, Tani Salazar, and she's with the Hawaii Dementia Initiative.
Thank
Thank
you
you
for
Good
so
joining us.
much for
Godspeed
having
and
me.
continued success with this, because it's not going to go away, but it can be an easier path if they work with you.
No, and with both of you, it's been a pleasure talking with you. I feel like we could do this all day.
All right. Yeah,
Thank
Absolutely.
we
you for
could.
talking with me.
All right. Much aloha.
Aloha.